love it, you're obsessed with it, really, aren't you? So, yeah, so a lot of the practitioners in the UK aren't using ultrasound so much. What do you think? Why should they?
Actually, ultrasound is adds a lot to your practice.
Yeah.
It's an imaging tool that participate or integrate in your daily practice. So help you in diagnosis, assessments, decision making, following up, decreasing the risk, of course. So increasing your safety, and even if you're practicing the aesthetic medicine or plastic surgeries, you'll need ultrasound in every step in your work. So I use it in the consultation, taking an idea about the anatomy and the variation of anatomy before I even proceed to make a decision. Sometimes look for old procedure, old fillers. Sometimes following up on procedures that I've done or referred to me to following up on results, on complication, and of course treating complications. So actually it has its rule in every step in your work. It adds a lot to your practice.
Okay, so for an aesthetic practitioner with a clinic who may do toxins and fillers, how can ultrasound benefit their practice? Can it get you more patients, or does it make you better? Does it differentiate you from other people?
For the patient, it's a tool that adds a lot of trust. So after using ultrasound, integrating it in my practice for like helping me and adding to my practice, I started to see the feedback from patients. Now it's easy to build trust faster actually when you have ultrasound, and yes, it helps you on all the steps. So it adds confidence to you and the trust that from the patient side. So yes.
Yeah. Okay. So if someone comes to the course for the one-day course, when they leave, Noor, what skills would they sort of be expecting to have achieved?
So one-day course, it's an intensive course as we planning for. It's an intensive course to make our candidates able to use and utilize the ultrasound device effectively to get the best image and be able to interpret this image and understand every layer and every detail in it. And also make decision upon this image they are already had on their screen. Also to be able to proceed and do the ultrasound-guided injection, whether to treat complications like dissolving fillers or to avoid risks like avoiding blood vessels or old fillers. Be able to do the vascular mapping effectively, be able to recognize and understand the ultrasound anatomy effectively, and also to be able to recognize fillers. And this is very important, to recognize fillers, all injected fillers, all type of fillers, whether permanent or hyaluronic acid fillers, and be able to make decision like if this patient is I'm preparing a patient for surgical facelift, so I need to scan to look for the vascular anatomy, for the vascular variation, and also for the old fillers, because I may need to take that decision to dissolve these fillers before proceeding for the facelift.
Okay, so for a facelift, you would always recommend an ultrasound?
Yeah, sure.
That's interesting.
I see a lot of patients after facelifts who comes for ultrasound scan because they don't like the results. They are not satisfied, and when you put and they say I'm swollen for like more than 6 months now, but when you put ultrasound, it's not swelling, it's old fillers that moved and pushed to different places
Yeah.
after the facelift. And simply, of course, dissolving them after the surgery does not guarantee the best results he wants, but dissolving them before is, I think it's a necessary step before proceeding to facelifts, also rhinoplasties.
So all rhinoplasties you think should have the fillers dissolved. That's interesting as well. That's
Yes.
that's very interesting. And you were telling me about occlusion. So if you are in aesthetics, if you do, I mean, you see quite a lot of occlusions because you're sort of a specialist, aren't you?
Yes, I do. For it's my sixth year now. I've more than 5 years using ultrasound in my daily practice, and I've been known for treating and managing aesthetic complications, especially vascular occlusion.
Very high profile people, yeah. So you said you had one particular case of a vascular occlusion, which you treated with you were telling me about, yeah.
Yeah, the most recent one.
Yeah.
We were, yeah, so that case, she was a blogger of plus 10 million followers, and
Yeah.
she had, unfortunately, vascular occlusion. She went for non-surgical rhinoplasty, and it didn't went as she wants, and
Yeah.
the dorsal nasal artery actually was occluded, and all the branches on the right side, actually also the left side was affected, and it was referred to me on the third day, I was able to restore the blood flow, locate the occlusion, treat it precisely, not wasting the time, not wasting a lot of highlights, injecting precisely, directly, and restoring blood flow with the first day. Yeah, first day. It took me 2 days to restore all the blood flow, and yes, you save tissue, you save patients, you make an experience that may be a very bad experience to the patient and her family. You just treat it confidently with less stress. Vascular occlusion brings so much stress to the clinic, to the patient, to her family, to the doctor.
Yes.
But using ultrasound actually make you treat this with calmer and more confidently.
Yeah. So there was the dorsal nasal artery. Now, from my anatomy days, that's where is it? It's on the Where
yes,
is it?
it's on the side of it.
Yeah, and where's it from? Where's the origin from?
So it's just like it's like an anatomy test, right?
Yeah, I can't remember, but it comes down.
So there is a lot of variation, but you can easily track the facial artery, because when you see vascular occlusion, you have to track the vessels from the start. Because if you just put your ultrasound directly on the damaged area, you may get lost, because it is damaged and there is reduced blood flow, and there is like new vascularity happening around, and you may get lost. So you need to start like with the facial artery tracking, following the course of everything until you reach the angular artery, and then you start to look the branches from there.
And where was it blocked in this case?
It was blocked. It was the right side dorsal nasal artery, and actually in the glabella also there was ischemic skin also. So we had to extend the scan to the supratrochlear, trochlear and orbital.
And supraorbital.
Exactly.
Yeah. So you can map them all and you can see where they. Does that mean? And you think so? In the old days, before ultrasound, you would have had to put hyaluronidase everywhere, and now you can specifically target it.
Exactly. You don't need to flood the area with hyaluronic acid. You can treat the tissues more delicately, more precisely, and inject the little amount of hyalase directly in the affected area or the damaged or blocked vessel, and restore the blood flow. And you can see this on your skin immediately. You can see blood flow comes back right
Yes.
after the injection. So
Yeah.
you inject Hyalase, you give patients few minutes, and then you put your ultrasound back, and you see blood flow, and it's a moment of relief, actually.
So you can see the artery blocked, and then you see it open up and flow. Yeah, it must be very rewarding. Now, so fillers, you were saying, Noor, that a lot of the fillers, when you assess them, aren't where they're supposed to be. Is that right? Or they migrated, or they're not in the right layer?
Exactly. You can judge a technique. You can judge fillers. You can judge the behavior of the injected fillers. Like you can even recognize high G prime fillers from the dynamic ones.
How
Everyone
can you?
has its criteria that can seen obviously and clearly on the screen. You can know and recognize the calcium fillers,
And you,
PLLAs. Everything has its criteria that you can recognize and diagnose on the screen. And we're going to learn all of that in our course.
so what will the people learn? So the delegates on the course will. So if they've got a scanner, they can bring it. Is that
Yeah,
right?
of course. If
Yeah.
you have a scanner, bring it.
Yes.
Because I know there is a lot of practitioners out there. I've seen that many times in the courses that they have this scanner, but they
Yeah.
didn't get enough training,
Yeah.
so it's not there. It's very exciting. You bring your scanner, you use it, and you start actually saving anatomy images and fillers images to your
Yeah.
cloud. So it's there. It's like you started using the thing, and you go to back to your clinic with knowledge and ready to practice, ready to put your ultrasound, take good image, understand this image, make decision upon them, and treat your patient and mitigate the risk, and even treat complications. You gain
Yes.
the trust of your colleagues. They'll be referring cases for you because you know that you can scan and you can tell them what you see.
Brilliant. That's really good. And also, I mean, to me, ultrasound, to someone who hasn't seen it before, just looks like grey lines. But I've seen the AI, which helps you with the layers and the live needling, so you can actually. So, how do you make it easy to understand?
So AI is a very nice feature in Clarius.
Yeah.
It's amazing because it helps you to get more familiar with the shades of gray. It
Yeah.
adds the colors to the screen,
Yeah.
and it's called T mode, which is T4 texture mode. So it gives the color, like right color to the muscle and yellow color to the subcutaneous tissue, fascia and skin, and you don't need it all the time, but
No.
in the beginning it's just make you able to be familiar with the shades of gray, and then you get to learn this easily because you'll be able to recognize the pattern of the muscle and the let's say subcutaneous or adipose tissue. And actually with knowing the anatomy, using ultrasound is a way to confirm what you already knew. So instead I was just saying that to my colleagues this morning in the lecture in Cairo, that when you treat a case, when you proceed to inject or to dissolve or anything, your brain brings and recalls whether to the image of anatomy that you used to study from books,
Yeah.
or the cadaver, if you had the chance to be in a cadaver
Yes.
dissection. So this is how the brain works, brings you images from what you learned before. But actually using ultrasound, you just put the ultrasound and you see the real live anatomy, real-time scan. Tissues and layers are sliding and gliding and moving. You can see how they react, how they behave toward your injection. You can see how the needle goes, how the cannula, what the cannula does, how this product behave on the day of injection and in the following week and in the following year. And it gives you enormous amount of data, and every one of us will utilize this in
Yeah.
different ways because we're different. So one will be like famous after reading Complication. One will be like participating in many studies
Yes.
and papers,
Yeah.
and one will be using it for their practice like every day in the clinic or the OR. And yeah, I've seen different amazing brilliant mind processing these black and white images into great things.
Yeah. And yeah, it is the way forward, isn't it? Definitely. We've got a question actually, Noor, from Keely Lamb. Can you scan threads in the face?
Yes, you can scan threads according to, of course, the type of threads. Actually, it helps you to maybe, if in cases of infection, sometimes you need to get the thread out, to get the foreign body out of the face, and it's a very hard job to do unless you have ultrasound. You locate the thread, take it out, and help drain the pus and help the face to heal. So yes, you can see them on the day, of course, of inserting them, or on following up on in case of complication, if you want to get rid of them. So yes, you can look at threads, and there is many nice papers about threads on ultrasound, because they are different materials, so they give different echogenicity on the screen, just like any other structure. And of course, it helps with filler migration. Of course, you'll confirm, is your technique safe? Is this space or this technique target a space or an area or a layer that secures your fillers or no? And you get to using ultrasound will make you able to modify your techniques to avoid migration and to treat them, of course, when they happen.
Give us an example of that. How does it limit migration? How does it...
Using ultrasound?
Yes.
So using ultrasound is a key to understand the anatomy. And if you understand anatomy, let's say for the lips.
Yes.
It's very common, the fillers outside the lips, around the lips. It's very common in the perioral area you find fillers, and it really changes the face. And sometimes a patient comes complaining from fillers around her mouth in the perioral, and then she dissolves it. And then she gets a new injection, and then the migration happen again. So you have to think, why did it happen?
Yes.
So using ultrasound, this is my experience. So it happened with me. I understand the closed system of the lips. Now I understand that how deep or how superficial I have to be to inject above the muscle, just below the dry lip.
Yeah.
And how far I should go and where to stop to avoid injection beyond the wet dry border, so I don't get fillers in the wet mucosa.
Yeah.
And where I should start my injection to avoid injection beyond the vermilion border, or even inside it. So you get this delicate with needle and with anatomy when you use ultrasound.
Yes, so you can really see exactly where it's going. It
helps your brain to respect the anatomy and feel like everything you've read before, every lecture you attended. Ultrasound brings everything to reality.
Brilliant. Well, thank you very much for joining us. So just about you, Noor, so you're a plastic surgeon, aren't you? And you do a whole range of treatments, but ultrasound is what you're really known for.
Yes, I'm in love with it. I'm spending so much time in the clinic using ultrasound. Yes.
And do you do it with? I mean, do you do it with every patient, or do you?
I started using ultrasound with every patient because I wanted to learn. Because the learning curve is a challenge. But if you just use your ultrasound every day with, let's say, I do with every patient, but if you do it a list with like half of your patients, you'll get more experience with it, and you're gonna learn a lot, and it will add a lot to your practice. So yes, I started using it every day because I wanted to see a lot and understand a lot, and then I became more confident, and it helps me making decisions and avoiding others. So complications. So now I use it every day with every patient. Every patient, sometimes only in consultation, even if I'm not proceeding to inject or to make any minimally invasive procedure. I use it in the consultation. Sometimes you just put it ultrasound on the patient face on the day of consultation, and you simply find silicone oil. So thank you. I'm not gonna touch you, my dear. You can't.
Silicone oil.
Yeah, silicone oil or silicone fillers that scatter the ultrasound wave, and actually you cannot scan anatomy below it, and you cannot even perform a Doppler like you cannot follow a vessel if there is silicone oil.
Really?
So if I proceed to treat this patient and then occlusion happens, I won't be able to help her even if I have ultrasound. So from the start,
how common is silicone oil now?
It's not really common in Egypt. I've seen few patients, but I've seen many coming from outside of Egypt.
Yeah, in Thailand and places, I think it's quite common.
Exactly.
Isn't it?
Yes.
God, that's really interesting. So do you think, I mean, I know you love ultrasound, but do you think in 10 years' time, every aesthetic practitioner is going to be using ultrasound?
So to answer this question, I wanted to just think about gynecologist.
Yes.
Would any gentleman take his pregnant, expecting partner to a gynecologist who has no ultrasound? It would feel weird, unsafe, and not logic. So I think this is the future of ultrasound, because there is a lot going in this market and in this field, and it is time for this technology to be integrated in our practice, to bring more safety and to avoid the risks, and to bring more scientific researches about the face anatomy, and also the injectables that we trust and we inject with the knowing of studies. So it is time that we perform these studies every day in the clinic, so we get to decide what is safe and what's not. So it's like patient comes and asks for something because it's popular, and I provide it because I don't want to be left behind. No, it's not like this anymore. You have, as a doctor, to scan and see what happens before and after the injection, and to know how these products affect our faces. So yeah, it's time to put safety first.
Yeah, and you can sort of map the face, so you can document exactly when you see a new patient, you can get a scan and you know exactly where the filler is before you start. Otherwise, you don't really know, do you?
Of course. And medical legal wise, it's very important. You can include Clarius is amazing. You have the cloud, you have server, you have all your patient filed like files, pictures, images, notes, and you can use this in your reports. And medical legally, it's very important to have scans for before and after injection. It's safe. It is a lifesaver. I have.
So tell me about that. So all your scans are saved. They're all documented. It's all secure. Why is it good medically legally?
So I think it's common everywhere. The scenario of this patient who goes and says that this doctor caused me harm.
Yes.
Or she maybe really thinks she's a victim, or sometimes she plays victim.
Yes.
So a good doctor who has good consent, of course, and writing your report in this situations,
Yes.
including or attaching ultrasound images of before and after treatments, proves it's a proof of what is happening. So
Yeah.
so there was the story about this patient who went to sue a doctor after just the next morning after dissolving fillers. She goes with her lips swollen and of course blue lips.
Yes.
And simply the doctor says this is 24 hours after dissolving. It is normal. The patient has signed the consent that says this is normal and expected, and here is ultrasound images of her lips before dissolving and after dissolving.
Yes.
And we are expecting her to follow up and also provide new ultrasound scan for her after healing or through the healing. So imagine this. Imagine this. It makes you stand confidently, proving that you take care about your patient and you have safe practice.
Yes. Okay. So thank you very much. So guys, aesthetic practitioners out there, I think it's a great thing to do. So it's the future. So, you know, it does set you aside, doesn't it? Make you a specialist, but you've got to, it does seem to, it's quite a practical thing, isn't it? You actually have to spend time learning. It's interactive. So if you have got a machine, that's that was bad, wasn't it? If you have got a Clarius machine or any machine, you know, please let us know and come along to our course. And Noor, thank you very much for joining us.
Thank you very much for actually help me to fit this live in my crazy schedule.
Yeah.
And I'm very excited for our course in London, and very excited to meet everyone. And it is not, let me say this, it is not hard to learn ultrasound. It is very possible. And it is just a tool that will confirm everything you knew and you studied before, and it will add a lot to your practice and will set you apart.
Yeah, so come along, come and meet Dr Noor. We're going to have a lovely time in Buckinghamshire, and we're all going to learn how to ultrasound and differentiate our practice, and most importantly, treat patients well.
Of course, safety first.